Hello, Dr. Krishna. Hello.
Hello. शेयर करूँ मैं? ये Anshika, please start the session.
हेलो
हाँ अंशिका स्टार्ट कर दो.
हेलो
Hello.
हाँ जी, am I audible?
Yes. Please start.
Okay. So a warm welcome and fresh morning to everyone present in the today's lecture. Since last 1 month, we at a student wing committee conducting this research statistics lecture series. And I'm sure this lecture series is definitely helpful for each and every student. Concept of students regarding this topic. For this, the great share goes to our respected speaker, Dr. Poonam Savarkar ma'am, who with their busy schedule take out their time and help us to. I would like to invite our favorite guest, Dr. Poonam ma'am. And before that, I would like to give a short intro about her. So Poonam ma'am is a BS MD Panchkarma, PhD Panchkarma certificate course of care. Her academic positions, she works as an associate professor and PhD supervisor in the Department of Panchkarma, Mahatma Gandhi Ayurveda College Hospital and Research Center, Salud, Wardha. She has a total research experience of 14 years. Her achievements and awards, academically, she has been awarded as the Best Houseman Award in 2010 in postgraduate Mumbai, and as a Best Student Award in 2010, as a Best Teacher and Award of Excellence in Panchkarma in 2021. Poster Awards 2, Best Essay Awards 4, and publications are, she has got 12 chapters in reputed publications. She has 85 research articles and Medno, 62 paper and poster presentations in various international and national conferences. Also, she's working as associate editor, editorial board member, reviewer, different journals such as International Journal of Herbal Medicine and Medical Science Research, International Journal of Scientific Research, IJSR, Joint Smith. She has been a guest speaker at 25 national and international conferences, and as a chairperson at total 12 national and international conferences. That's such a great CV. She has completed 9 university level and 3 are her ongoing projects. So I would request her to please come and start her lecture. Thank you.
Thank you, Dr. Anshita. I'm audible, Dr. Anshita?
Yes, ma'am. Please continue.
Okay, and my PPT is visible?
Yes.
Okay. A very good morning to all my senior faculties, guides, my colleagues, and my dear students. In today, actually, first of all, I would like to express my sincere gratitude for the organizer for giving me this opportunity to share my some views regarding the research study design. Actually, this is the national platform on which every student exposed to a great knowledge from the different speaker. The previous speakers, that is Dr. Kiran Tawlare sir, Dr. Amit Nakani sir, have made my task very easier because they have made a great platform and a great foundation for considering the complex terminologies in the research for making me this topic very in a simplified manner. So thank you, these my all senior faculties. And in within some minute, we will share some various aspects of the research study design. Actually, we will throw some glimpses that is this particular topic, that is particular subtopic, that is the why there is the need of choosing this topic, or what is the importance of that today's topic. Including that, we will also discuss some types of research design, what are the components of that particular designs, and what are the strengths and weaknesses of each and every design for the proper selection of that particular design in our research study. And at last, the key points to be remembered. These are some glimpses of my presentations. First of all, as already you are aware through these various lectures which were carried out before this presentation, you are already aware that research is a systematic process to acquire some knowledge, a particular knowledge, whether it is specific one or whether it is generalized one. Ultimate aim of all this research activity is to find out some practical solutions for a health problem, not just health problem. It is already commercial purpose also. Actually, particular in our medical field, this type of health research or medical research can be categorized depending upon the type on which level it is carried out. First of all, that is the individual level and then community level. Generally, in the community level, which type of health research is carried out, it is totally aimed to improve the community behavior and health practices, because it is basically planned to sort out or to find out some remedies regarding the health issues in the society. On the other hand, at the individual, which type of health research is carried out, it particularly focused to promote the healthy behavior of the individual, to achieve the prevention of diseases at a personal level, and to rule out a causative or risk factor of the illness on the personalized approach, and to rule out or to study the etiology of various diseases. Again, it is also helpful to make an early diagnosis of a particular clinical condition at an individual level. Along with that, it also helps to make or to compile some adequate references or clinical evidences for the appropriate line of treatment. And along with that, it is also helpful for the rehabilitation, which can be done in a various clinical conditions at an individual level. So these are the primary advantages of the medical research, which can carried out at an individual level as well as the community level. This medical research is primarily composed of the primary and the secondary based on its origin. Actually, when new concept or new information is visualized or it is tried to find out through the medical research, generally the epidemiological or clinical studies are the best example, which are called as the primary medical research, because it is these are totally focused over the distribution of diseases and other health related conditions in the society. On the other hand, the secondary type of medical research, it is primarily composed of the critical appraisal or the summary of information based on the previous existing knowledge. So generally the meta-analysis or the systematic review are the some examples of secondary medical research. On the other hand, when we go forward, depending upon the different head, this medical research can be categorized into the different sub-classifications. Actually, I am taking all this classification of medical research because it is very essential to choose the appropriate type of research design for our study. So based on the nature, this medical research can be categorized as the qualitative and quantitative one. Generally, qualitative type of medical research is typically carried out with the help of some open-ended or close-ended questionnaire or based on some personal interviews. While the quantitative medical research is completely, it can be descriptive studies, it can be correlational studies, or it can be the experimental studies which are carried out at the level of animal or in the human being. On the other hand, based on the direction, that is the medical research can be categorized into retrospective one and prospective one. Generally, in a prospective type of medical research, generally these observations are specifically intended or followed for the such type of people who are at a risk or who are susceptible for particular type of health condition, and particularly these are focused over the outcome which are happening in the future. On the other hand, retrospective is totally controversial of that, because the information on the outcome is already available and we are seeking for the specific causative factor for that particular outcome. So this is the concise review of some classification of the medical research, which will be helpful for selecting the appropriate research design. Before that, I will share that is the study design. Actually, what is the study design? Why it is necessary? Because actually study design, it is a very core part, we can say the heart of the study, because it is a primary but most important part of the methodology of our study. And generally it can be explained as it is a scientific format or a protocol of the study which convert the conceptual act of or conceptual thought of our basic aim of our study into the operational act, because based on that protocol we will move forward to pursue our aim. On the other hand, so as I told earlier, based on the direction, the study design can be categorized a retrospective one, prospective one, and even ambidirectional study can be planned. Why we have selected this topic? Because generally in the today's era or even previous also, there are the multiple challenges in selecting the study design or while its implementation. Generally what happened during our PhD study or even PG study, at the starting we select some thought or we select some concept to carry out research over that. But generally what happened after IC clearance, there occur multiple problems. We faces some practical difficulties while conducting that type of research. So if we select appropriate study design, then such type of hurdles can be avoided to some extent. So generally, and if we select some improper design, which is not a practically feasible one, so it may definitely yield into the futile kind of research, which ultimately that is the time waste also, money consuming also. So it is a very painful thing for the devoted researcher. So proper selection of study study design is a very important to nullify or minimize the effect of confounder also, because when we draw some conclusions or inferences based on the observations of the study, there are certain factors which indirectly affect over the outcome of the study called as the confounder. So to nullify the effect of that confounder, the proper selection of study is very essential. So in short or in a nutshell, we can say that to make all aforesaid research sound and fruitful, the proper study design selection is very, very necessary. Now we will come forward for the classification of various study design, because as I told earlier, the research can be carried out at an individual level as well as the population level or the society level. So based on that, there are some specific terminology can be used here, that is the epidemiological study. So epidemiological study can be carried out depending upon their nature, that is descriptive one and analytical one. These are the specific type of study design. On the other hand, descriptive type of study can be carried out at individual level and population level, which is also called as ecological study. When we carried out some descriptive type of research design at an individual level, for example, case report, we generally publish the case report. We generally publish the case series, and some types of cross-sectional study are some component or are some types of this individual level descriptive study design. On the other hand, when such type of descriptive studies are carried out at an society level or the population level, it is called as ecological study, and the survey or the census, it is the best example of such type of study design. On the other hand, when we go the critical analysis or when we go through analytical study, there are certain sub-classification of study design. That is first one, observational studies and interventional studies. These observational studies are generally performed at an individual level. That means the unit of the study is only single individual. For example, that is observational studies, case control study, cohort study, cross-sectional study. These are some examples of observational analytical studies which are carried out at an individual level. In the further some slides, we will focus the detailed description of this type of study. On the other hand, when analytical study are carried out with some particular intervention, that is such, for example, RCTs, which generally clinical trial. So it can be, there are certain sub-classification of such type of interventional study that is based on the randomization. It can be randomized control clinical trial or non-randomized control clinical trial. On the other hand, based on the blinding purpose, it may be single or it may be double blind study. Based on the site when the study is performed at the laboratory level, in the clinical level or the field level. So these are some classifications. On the other hand, based on the type of design, this interventional analytical study can be further subclassified as parallel study and crossover study. So this is the concise classification of analytical and descriptive study design. Then we will see one by one. Now the case. First we will focus that is the descriptive study. Generally, the descriptive study generally answer the particular research question by asking what, when, where, who, and how happened at a particular event. So it can be carried out on a small or large scale. Generally, it gives some answer regarding the year, season, months, week, or even climatic zones, country, region, urban. It describes some specific occurrence of any clinical activities at some particular age, particular gender. On the other hand, some studies which are related with the birth order, family size, height, weight, blood pressure, and etc. So such type of study are generally describes the characteristic of a particular situation or health event or case in terms of time, place, and person. For example, in 2000, what is the ratio of, or what is the prevalence rate of hyperlipidemia in the Maharashtra zone? So this is the example of descriptive study. What are the uses of descriptive study? Because until and unless when we will go through the shortcomings and advantages of each research design, we can't select the proper research design. So shortcoming, that is the lacuna and advantages of these each and every research design is very, very essential. For example, what are the uses of descriptive study? Generally, these are helpful to generate the hypothesis for the further research evaluation in the future. It also suggests or established association between the two or many components. That means the smoking and the incident of the carcinoma of lungs. So to study the correlation between these two things, such type of descriptive study are necessary. So it may be helpful to establish some cause and effect relationship between the two factors. On the other hand, what are the limitations of such type of descriptive study? Generally, these are not useful to test the hypothesis. Yeah, because generally in the clinical trial, our primary aim is to test the hypothesis or whether our study yields positive effect or negative effect. But in descriptive study, it just only establish or study the correlation between two or more things. Moreover, it is not useful to discover the definite answer or disapprove the hypothesis, because further analysis is very, very essential to pursue this study. On the other hand, most of the qualitative methods are used, therefore no replication of result is possible to use it in a further clinical trial. And at the last, the outcome of the study are highly depend upon the type of tool used for measurement and the observations. So integrity of the tool is very, very essential while planning these descriptive studies. Now, our next type of descriptive study, which is generally carried out at an individual level, that is the case report or the case study. Generally, it is the unit of study in this case, because individual we publish such kind of publications, that is case report, that is the case of sciatica, case of the MI, that is the successful management of this and this treatment in the management of this clinical condition, etc. So actually the case report or the case study, it is a type of descriptive study design which is carried out at an individual level. Actually, it is a detailed presentation of a single case, example, patient, health center, or a village. Actually, most of you are already aware about such type of case presentations, because in multiple conferences and seminar, you are used to present such type of presentation. So generally, it is common in the social science, management, and clinical medicines also. The primary aim of such type of publication of case report or case study, or the presentation for such type of case report or case study, is entirely focused at a particular clinical manifestation of the common disease, otherwise specific type of clinical scenario of new or unfamiliar diseases. Generally, some specific interesting findings if occur in a diagnostic of some common disorder, example, imaging, lab investigations. So based on that, we can do the case report also. So it is helpful to generate a novel clinical evidence of unrecognized illness you have not come across. So it represents the novel thing. So case report or case study should be based on the novel observations in the clinical setting. it is either to generate hypothesis about the pathophysiological mechanism, because in the discussion part of this case report, we generally elaborate the possible mechanism of our planned treatment to nullify or to subside the clinical entities in that particular condition, in that particular condition or in that particular patient. So these are the examples of some case published case studies, that is the contribution of Ayurveda for management of paranoia, a case report. This is the novel one. So such type of case report can be published or we can do. What are the strengths and weaknesses of such type of design? That is, first one, it is a very cheap tool, and along with that, it is a very easy for generating hypothesis. No any extra that is financial support is necessary to carry out such type of study. Along with that, it is very useful for uncommon clinical manifestations, or both familiar one and rare diseases also. So it is useful for both type of clinical conditions. And most important thing is that it is a very less time consuming in nature. What are the weakness of such type of case study or case report? First one, it can't be used for testing hypothesis because sample size, it is only single, or it is the individual based study. On the other hand, findings cannot be generalized due to the low external validity, because to prove the or to enhance the external validity of our research findings, we the sample size should be appropriate or the maximum. Now, what are the case series? When we'll perform or when we will keep the data of more than 11 patient or 12 patient, so and we publish them in the form of case series. So such type of case series actually do not, it is performed at individual level, but it is a group of more than 11 patient. Generally, it do not have a comparison group because it is a single type of study, and in which the patient having the same clinical conditions is narrated in such type of study design. And what is the study question in such type of design? That is the what is happening if we have already given some specific treatment protocol for a particular 10 patient of a patient having the diabetes mellitus. So we can actually we can see the proper effect of that therapy over this 9 patient. On the other hand, these case series can be do through the collection of desired information about the cases, which can be performed at an individual level in a larger group of subjects. Actually, more than 10 patient or more than 10 healthy individuals are necessary, or data related with this particular patients are necessary for making such type of case series. Actually, this case series describe the outcome from group having the limited number of clinical subject. So it is extremely useful for the clinician to document uncommon clinical manifestation in a certain set of patient. So these are some case series which are already published. That is Ayurvedic therapy, that is Shirodhara insomnia. This case series was carried out over the 12 patient, which showing the efficacy of the Shirodhara. And this is another example of case series, that is the management of proliferative diabetic retinopathy and its associated conditions using the Ayurvedic therapies. So you can go it. These are another examples of the case series which are already published. So if you have the data having the data with the patients having number that is more than 10, it can be considered as a pilot study. So the data or the observations which are obtained from this pilot study can be used for further planning of the other research, other randomized controlled clinical trial. Now, what are the strengths and weaknesses? Actually, it is a very cheap and easy to perform or easy to conduct. It is a very good tool to identify the uncommon situation or clinical manifestation of disease and to generate the hypothesis. As I already told, it provides the descriptive data on the disease characteristics. And generally, these are, as like case report, these are generally short term in nature. Now, what are the weaknesses of such type of case series? First one, as like case report, it is not useful for testing the hypothesis, and it has less reliability as there is no control or comparative group as like case control or RCTs, and there are most chances of bias. This is the main lacuna of this type of case series. because generally the chances of bias are actually aggravated because of the selection of the cases and information is collected by the researcher himself or herself. So generalization of findings or outcome is not possible due to bias selection or unrepresentative of subject and due to lack of control group, because researcher can make some manipulation also. So this can be considered as a authentic, or it can the observations which are observed through this case series cannot be generalized one. Now, the descriptive study which are carried out at an population level or in the society, such type of study called as the ecological study. It is also called as the correlation studies. Generally, the population or a group of members or a group of patient is generally a unit of study. It can be conducted at a country level, state level, or a specific particular region of the country also. It is actually population based study. Basically, it is planned to understand a particular problem for a group and relate that problem with the possible reason. That is again cause, and it is useful to find out the cause and effect relationship. And so ultimately it helpful to generate the hypothesis of future research. It is also useful to compare disease frequency between the different group during the same period of the time or in the same population at a different point in a time. I am giving some example of the such type of ecological or correlation study. For example, if we have to find out the incidence or prevalence rate of hypertension due to stress in India and USA at the same time in a particular duration, that is between 2011 to 2015. So such type of study can be considered as a ecological or correlation study. Another example of such type of study can be taken as the, if we have to find out the incidence of cardiovascular diseases into different state between the specific duration. So such type of study can be considered as a ecological or correlation study. The survey is the best, as I already told, the survey is the best example of such type of ecological study or a census. Generally, the basic aim of such type of survey is to analyze some aspect of the study at a population that which they represent. So such ecological study can be carried out by making the survey, and two components of the research survey is very, very essential. Primarily, in such type of survey or in such type of ecological studies, the collection of information is generally done with the help of some open-ended questions or closed-ended questions, or task-based some tools can be used for the data collection of such type of survey. What are the strengths and weaknesses of such type of survey? Generally, the any type of survey generally the short-term in nature, and it gives the rapid answer to a particular specific problem which we have already intended. And along with that, it is also helps in stimulating hypotheses for undertaking analytical study in the future. What are the weaknesses of this study? It is useful for testing the hypothesis. It do not have individual level data, so unable to estimate the individual's risk for exposure and distribution of the disease. It is very difficult to control for confounding factor. So these are the basic weakness of this such type of sorry for the interruptions. So these are the weakness of the this such type of ecological study. Now, our descriptive details of our descriptive study is already here completed here. Now we will focus over the some next type of study, that is the analytical study design. And generally, such analytical studies are generally categorized based on the intervention is already done in a particular study group or not. Based on that, this study can be categorized as experimental study and observational study. If we have already done or researcher have already done a specific intervention within a specific group, it is called as experimental study. So it generally the random allocations of the subject are generally done here in such type of study. If randomization is there, then it is called as randomized control clinical trial. And if randomization not done, then it is called as non-randomized control clinical trial. On the other hand, if researcher has not done any kind of intervention within the study subject or within the population over which he or she is doing study, so it is also called as analytical observational study design. And if there is comparison group, then it is called as analytical study. And again, if there is no comparison, it is descriptive study. If there is analytical study, so based on direction, it can be further classified as cohort study, case control study, and cross-sectional study. Actually, we will see one by one in a further slide. Generally, the cross-sectional study, it is a completely observational study, and in such kind of study, exposure and outcome at the same times are studied. For example, the particular clinical conditions and its particular etiological factor or the cause. The observations regarding both are noted at the same time. On the other hand, case control study, generally it is a retrospective one, and the outcome already present here, and from outcome we take we try to find out the exposure or the cause of that particular outcome. So it is a part of case control study. On the other hand, when the exposure and its related possible consequences or possible clinical conditions in the future are studied in the cohort study. Now, what is the basic difference between the observational one and experimental one? Actually, observational studies, there is no any assignment of intervention, as I already told. But in the experimental study, assignment of a specific intervention is to be planned. It may be any drug, it may be any investigation, it may be any preventative protocol. On the other hand, in the observational study, any exposure is not manipulated by the investigator. There occur just only observation between the cause and effect. On the other hand, in the experimental study, specific exposure is manipulated or controlled by the investigator. For example, if I am giving some example at the last, in the observational study, no any change in the environment of study participant in which they are living because no intervention is there. On the other hand, in the experimental study, the response of the study participant or any influence or change occur in a particular intervention after the assignment of that particular intervention or particular exposure. So such type of effect is studied in experimental study. Now, what are the examples of observational study? For example, if we have to find out the prevalence of COVID-19 in a specific prakriti, it can be just here we are just observing, that is which type of prakriti are more susceptible for getting COVID-19 infection. Another example of such type of observational studies is predominance of the specific symptoms of COVID-19 vaccine in a different prakriti, because we have already observed that after taking the COVID vaccination or different type of vaccination, there occur multiple symptoms in a different type of prakriti. Someone suffers from any clinical ailment after taking vaccination or someone not. So it can be a topic for the observational studies. So I have taken here, that is if we have to study the predominance of specific symptoms of COVID-19 vaccine in a different prakriti, it can be a observational study. On the other hand, what is the example of the experimental study? If we have to evaluate or we have to assess the efficacy of XYZ churna, that is particular Nisha Amal ki churna, with that of metformin in the management of diabetes mellitus type 2 on a certain variable, that is on the blood sugar level or HbA1c. This is the example of the experimental study. Now we will move forward now. That is the observational analytical study. Actually, as I already told, based on the direction, this observational analytical study can be carried out cross-sectional one, case control one, or cohort one. That is generally in the observational analytical study, investigator does not assign any exposure. Just we have to just observe. Second type of observational study having a comparison group generally, and there is no randomization as like randomized control clinical trial, and it is helpful to analyze the journey between exposure and outcome. So this is the basic composition of the observational analytical study. Now, first one, that is the cross-sectional studies. Actually, cross-sectional study, as I already told, these are the observational study. It can be called as instantaneous, prevalence study, or transfer study, or simultaneous study, or cross-sectional analysis, because cause and effect. Dr. Krishna, please ask everyone to mute their self, because there is some interruptions there.
Okay, ma'am. Okay.
So actually in the cross-sectional study, at the same time, we are studying or we are assessing the cause and effect. So the unit of study is individual one, that is selected based on the particular variables. And what is the study questions in such type of cross-sectional study? That is what is happening. Second one, the collection and observation of data regarding health and non-health information. It is generally done at a specific point in a time. On the other hand, time frame is present because it is very essential while doing the cross-sectional study. Generally 2 to 4 weeks or months, it is the necessary time period which is essential for the cross-sectional studies. And it is most common and very widely useful analytical study. It is specifically useful in the various school examinations or in the various hospital at the community level. Now, generally, what tools of that or what tools are generally used for the data collection in planning of the cross-sectional study? That is, we can collect the data in such type of cross-sectional study with the help of face-to-face interviews, or even Google form or mail questionnaire or other self-administered questions. Electronic mail can be utilized to collect the data, or web data, or generally the personal interviews, which can be taken through telephones or cell phones. So such type of tools are essential for the data collection in such type of cross-sectional studies. What are the uses of these cross-sectional studies? Generally, the cross-sectional studies are generally planned or generally used to measure the burden or the magnitude of the particular disease in a particular society, in a particular region of the country, in a particular country, or in a global wise. So it is also helpful to measure the prevalence of the disease or its risk factor in a clinical based sample in a defined populations. And it is very, very essential to understand the distribution of health problem by time, place, and person. Here I have concise some example which are the all cross-sectional study. For example, first example is that what is the prevalence rate of dental caries in a school-going children? It can be a topic of cross-sectional study. Second one, what is the prevalence of physical inactivity among the school children, which may be responsible for the obesity in adolescent obesity. Third one, what is the prevalence rate prevalence of specific prakriti involved in the patient with hypertension or diabetes mellitus? That means which kind of prakriti is more susceptible for getting hypertension or diabetes mellitus in future? Or what is the prevalence rate of hypertension in a XY city, in a Nagpur city, in Aurangabad city? Because these are actually helpful to rule out the incidence of hypertension. So you can collect data or information about the type of addiction, type of diet, or any risk factor associated with that particular disease condition. Fourth example can be taken as what is the satisfaction rate among the patient attending the government hospital in Nagpur. It can be a cross-sectional study. Next example, what is the prevalence rate of diarrhea in a specific village? Specifically among that village, in a specific among that which particular age group is affected. So it can be example of the cross-sectional study. So these are some published data. These are the type of some cross-sectional study which are published and which are already available and a multiple database. Now, what are the strength of that cross-sectional study? because the completion of the study take place in a very quick manner as comparative to other study design. These are very easy to perform, inexpensive, and can be done in any setting. It is less time consuming, so it can be performed because exposure and outcome are examined at the same time in such type of studies. And data collection regarding one or multiple variable or outcome can be observed at a single point of time. That means hypertension and its associated diet, which is responsible for causing the hypertension. Both prevalence and association between the cause and effect can be identified at the same time through such type of cross-sectional studies, and it is used to prove or disapprove the assumptions. So it can be generate hypothesis, and based on that hypothesis, we can do further evaluation. Now, what are the lacunas of this type of study? And that is, these are unable to evaluate the time of exposure. Another limitation of this studies, it can be used to rule out the incidence and to study the rare diseases. So therefore, it is not useful to test the hypothesis as the clinical trial. Again, it cannot be used to analyze the effect of exposure over a period of time. So exposure and outcome, it can be studied at the same time. Exposure and outcome cannot be linked very well in this kind of disease, in this kind of study. An investigator has no control over the exposure of the interest. This is the basic limitation of such type of study, and therefore it is not useful to study the disease etiology. So we have to take into consideration the strength and the limitations of the cross-sectional study. Now our next observational study is the case control study. It is also called as case reference study or retrospective study because generally these are carried out retrospectively. Actually, in such kind of study design, the unit of study is population because it is the population based study. And what has happened, as I told, it is retrospective study. So it gives the answer what has happened in a particular clinical setting. So it can be a case control study. Generally, it proceeds backward from effect to cause. And so both exposure and outcome have occurred before the start of our study. Generally, for such type of study, there is the requirement of standard cases, that is people with the particular disease condition or desired type or type of interest of the researcher, or a suitable control or the comparison group, that is people without the selected disease from the same population or the same place. So this is the major essential criteria which is necessary for planning of the case control study. After that, we have to go retrospectively through history taking and we have to make assessment for possible exposure factor of the disease. The most core part of this study is we have to match proper cases, and control is the heart of study because comparison between the history of both cases and controls about the occurrence of possible causes, it is the basic aim of our case control study. For example, here I have accumulated some examples. For example, as I have already told, there are two groups. One, there is a case. Case means it is a group of patient having a particular or common clinical condition or particular disease or a particular health condition. It is called as case. And control, there is another group which is lack of any clinical symptoms or it is a healthy one. So it is called as control, and we are observing in both. We are comparing case and control. For example, we have to find out certain correlation between the insomnia and the excessive use of mobile app or excessive use of mobile. That is, researcher considers that there is some positive correlation between the use of excessive use of mobile and insomnia. So in such kind of study, we can take two groups. In one group, that is patient with insomnia, it is called as case, and in control group, patient without insomnia. And in case that is patient with insomnia, we will take history of all patients regarding how many of them are doing excessive use of mobile app to late night. On the another hand, in the same group, we will take history, that is how many of them are not doing the excessive use of mobile. So such type of observations we have to noted in our study. On the other, that is the control group, that is the patient without insomnia, we have to take the history of the patient which are doing the excessive use of mobile, and same another one we have to take the history for the patient who is doing who are not doing the excessive use of mobile app, and then we have to compare the both group. And after the completion of this study, we can reach some inferences that the patients which are doing excessive use of mobile are generally very susceptible for getting insomnia insomnia. So this will be our inference. The second example of the case control study, that is if we have select as a case that is the patient with Amvata, then such when we generally take the history of such type of patient. First we have to take about a history of particularly the diet and behavioral history or a causative factor, that is whether there is history of Divaswapa or Abhishandi Ahara in a patient of Amvat. At the same time, there may be some patients of Amvata, that is there is no any history of Divaswapa or Abhishandi Ahara. On the control group, there is we have to observe for the analysis of same etiological factor. So, and after that we can find out, or we can conclude as the most of the patients who are used to Divaswap and Abhishandi Ahara have the maximum chances of getting the Amvata in the future. So this will our conclusion. So these are the examples of the case control study. Another example can be taken as how much percentage of patient with cardiovascular disease having history of smoking or alcohol addiction. So this is also the best example of the case control study. Now, what are the elements or what are the steps for performing this case control study? First of all, we have to select the cases with the disease of interest. If I have to do some research work over the diabetes mellitus, then I have to take the patient with only diabetes only. So from the selected population, I have to select such type of cases, and then those are independent of exposure under the study from hospital or clinic. On the second step is that selection of control. That means the patients who are not having diabetes. So such type of patient can become as a control. Third step is that collection of valid information about the past exposure objectively. If there is generally we considered as the genetic history, it is a very it plays a very important role in the formation of diabetes in the society or in the future. So in both group, we have to take history whether there is in genetic history in their family or not from maternal or paternal side. So we have to assess both this information in the both group. And after that, after the collection of data, we have to go for the analysis of the collected information or the collected data. So that is we can take another example, that is analysis of various etiological factor for the dyslipidemia in a multiple type of group, that is in a hypolipidemic or dyslipidemic group, or consequences of excessive use of amla rasa leading to the palitya. So it may be a case control study. These are the published study which are already available on the database, so you can go through them. Now, what are the strength of this case control study? First one, it is a very fast, simple and economical one. Generally, it carried out retrospectively. So extremely useful to investigated causes of diseases, especially rare diseases. It is very useful. And generally, it is a very good for rare diseases or the disease having the long latency period. So it is the strength of our positive point of this case control study. Moreover, it can establish cause and effect relationship. Multiple exposure or risk factors and uncommon diseases can be examined at the same time in such type of studies, and it requires relatively few subjects than that of cohort studies. So logistic of this study are very easy. On the other hand, there are certain limitations of such type of study, that is the selection of control or an appropriate comparison is very difficult. it cannot measure the incidence or prevalence rate or relative risk in such type of study, which is possible in cohort study. And it has high susceptibility to bias. It is the only one study outcome can be studied at the same time. And it can adjust for confounding factor as it is retrospective in nature. So these are the basic limitations of the case control study. Now the cohort study, the next observational study is the cohort study. It is also called as, these are some synonyms of the cohort study: prospective one, follow-up study one, longitudinal one, or incident study. These are the some synonyms of the cohort study. Actually, it begins with the selection of exposed and non-exposed patient. Generally, the what is the research question in such type of study? The what is happening, because it is the prospective one. So to study the incidence of the disease or cause and prognosis of the disease, it is very, the such type of research design is very helpful. And it is also helpful to distinguish between the cause of the disease and its effect, that is ultimately the disease outcome. Generally, for such type of cohort study, there is a requirement of group of disease-free people with common statistical characteristic. That is common statistical characteristic with respect to age, gender, maybe birth date, year of marriage, etc. And after a specific time, we have to follow up. We have to take follow-up for expected outcome, that is occurrence or non-occurrence of event. Then comparison of the both outcome we have to do. That is any observational or epidemiological study which attempts to study the relation between cause and risk of developing disease at an individual level with a definite beginning and end. So such type of studies can be considered as a cohort study. Now there are the three types of cohort study, that is prospective one, retrospective one, and bidirectional. I have concised here some examples of particular type of this study. That is prospective cohort study. Yes.
Your slide and presentation is not matching, ma'am. Will you please check into it? Yes. The way
Yes, ma'am.
you
Your voice is not getting properly.
स्लाइड आहे, आर्टिकलची स्लाइड आहे. नेक्स्ट स्लाइड लावा प्लीज.
Yes, now it is visible properly. That is the type of cohort study.
नाही मॅम, ही पहिलीच आहे, आधीचीच आहे. ही स्लाइड आर्टिकलची दिसते.
Okay, just a minute.
Talk at a single slide.
Just a minute. How much time it is going on?
From before.
From cohort study, it is not coming, ma'am.
Okay. Just a minute. I will reshare. Just a minute.
Okay, fine.
Now, which slide is going on? That is type of cohort study is visible.
Yes, ma'am. Yes. Please continue.
Types of cohort study: prospective, retrospective, bidirectional. It is visible, na?
Yes, ma'am. Yes.
Okay. And now changing, na?
Yes.
Changing the slide. Okay. Sorry for the interruptions. That is the type of cohort study. It can be prospective one, retrospective one, and bidirectional one. For example, prospective type of cohort study, that is by the time when studies start, exposure and disease has not yet occurred. For example, it is actually the one major cohort study, major prospective cohort study, which was already done in 1940. It is also called as the Framingham Heart Study. Generally, it is the oldest cohort study. And generally, what happened in this study? We are observing the exposure and the outcome which is possibly in the future. So objective of this study to identify the risk factor for the cardiovascular disease in the future. So this is the example of prospective cohort study. Then what about retrospective study? That is both the exposure and the disease, that is the cause and effect, both have already occurred when you start the study. So for example, there is one study which is carried out at Bhopal, when we have to find out certain correlation between the dye exposure and the incidence of a CA of urinary bladder. because generally the aniline dye is basically responsible. It is the carcinogenic and it is responsible. It is the chief factor which is responsible for causing carcinoma in a future. So this type of study which was carried out, the researcher had observed that there is association between the exposure of the workers who are doing work in the dye industry. That is, exposure have already done, and the researchers had created a data, that is how many of the workers who are doing work in dye industry had get suffered from the carcinoma of bladder. So in this study, the exposure and outcome both are present when the researcher was doing the work. So it is called as retrospective study. On the another hand, there is bidirectional study. The combination of these two approaches, where when study start, the exposure has already occurred, and then you have to follow this exposed and then exposed individual till they develop the outcome. That is, we can give I can give one example. That means, for example, in 2 or 3 years before, or in this COVID pandemic, the patient who have already get suffered from the COVID-19 infection. So ultimately, there is some strotovaikunya in the lungs, or there may be certain its residual impact of COVID-19 in the lungs. So it can, such type of study can be planned. That is, in future, in such patient who are already getting COVID-19 infection, how much of them will develop some certain kind of respiratory ailments in future based on due to the infection of that COVID-19. So such type of study can be example of the bidirectional study. It is also called as ambidirectional cohort study. So my slide is changing now, Dr. Krishna?
Yes, ma'am. Yes.
Okay. So such type of cohort study can be planned. For example, studies on Ahara Vihara conducted among Ayurved College and its future impact on their health. So it can be a prospective cohort 1. And then example of retrospective cohort can be given as the clinical outcome among COVID-19 patient managed with modern and traditional Siddha medicine retrospective cohort study, which is already carried out at Chennai, Tamil Nadu in 2020. It is the good example of retrospective cohort. And bidirectional cohort, that is, as I already told, that is the person having the COVID-19 and its impact on the respiratory system in the future. So it is the best example of the bidirectional cohort study. Now, what are the steps which are essential for planning of the cohort study? First, we have to select the proper cohort. Cohort means identify the study subject, that is cohort, that is the population. And next one, we have to obtain baseline data on exposure, measure the exposure at the start. The exposure may be a particular time, particular place, etc. Then we have to select a sub-classification of the cohort, whether some of them have exposed or unexposed to a particular exposure. And then we have to then take follow-up, measure the outcomes using the record, interviews, that is which tools we are using for assessing the data. And then we have to do the analysis of that particular data collection. So these are the basic steps of the cohort study. I am giving another example of such type of cohort study. For example, we have to find out, as I already told, it is called as incidence study. That is, through cohort study, we can measure the incidence of the particular clinical conditions, or we can measure the particular relative risk of particular disease condition for a particular individual. So generally, the patients who have not exposed to a particular exposure, and then among them how many develop the disease, and among them how many patients they have not any development of particular disease condition. For example, we have selected, that is a one group, that is the patient who are not doing any kind of pranayama or any kind of yoga, and in future we are examining them, how many patient getting COVID-19 and how many patient how many person they are not getting COVID-19. Another group in this study is the patient who are doing regular pranayama, and the patient who are doing regular pranayama how much of them getting COVID-19 and how much of them not getting COVID-19. So such type of study, that means we are going forward, that is from cause to exposure. So it is called as prospective studies one. So another example can be given as the observational study to assess the effect of Kapalbhati in diabetes mellitus type 2 and their lung capacity in the future. So such type of study can be planned. What are the strength of this cohort study? That is, we can generate a good evidence of exposure and disease, and many different outcomes for the same exposure can be measured because it is most of the time prospective in nature. And fund should be more because it is a very time consuming, and sample size should be appropriate or maximum. So it can assess cause, incidence and risk factor of the disease at the same time. And it is very especially good for useful for the uncommon or rare exposure. There is the less possibility for selection bias and biased exposure data. It can't be manipulated. On the another hand, what are the shortcomings of such kind of cohort study? That is time consuming, long term one, because it is generally doing in prospective manner. It is expensive in nature due to the large sample size. It can't study rare outcome or unsuitable for rare diseases or disease which have a very long latency because it takes more time. And there are more chances of confounding factors also, and outcome data may be biased. So we have to take a good, to avoid this, we have to take a good follow and with our within our tools. And there is a possibility to drop out the patient due to the long-term follow-up. So these are some limitations of this study. Now here we have completed the observational study design. Now we will move forward towards the experimental study. As I already told, when there is some interventions in planned within the study group, it is called as experimental study. Based on the site, based on the randomization, based on the blinding, it can be again subclassified into, it can be carried out at the preclinical level and clinical level. In preclinical experimental studies, these are the laboratory study, analytical study or animal study, which can be carried out in a different animals. In laboratory or analytical study, multiple type of pharmaceutical or phytochemical or physiochemical analysis of any drug, any bhasma. So such type of study can be carried out, or it can be considered as a preclinical studies. Specifically, it is planned for the standardization of some medicines, some decoctions, some formulations, etc. And generally the antimicrobial content, generally toxicity study or safety study are generally comes under these categories. While on the other hand, at the preclinical model, generally the animal studies are conducted for the various pharmacological effects or any toxicity. In vitro and in vivo studies are considered in such type of section. On the other hand, the clinical studies based on the aim, that is the intervention, that is the type of intervention or the nature of intervention which we are doing, that is whether it is treatment, whether it is preventive protocol, there may be any diagnostic tool, there may be any screening parameters, there may be quality of life trials. That is through clinical trial we can assess the efficacy of new treatment protocol, new any prevention protocol, new any diagnostic tool, or new any screening factors, or we can assess the effect of our intervention on the quality of life of trial, generally which are generally done in a patient having the carcinoma. When we are doing some study to showing the efficacy, adjuvant effect of our Ayurvedic intervention in a certain disorder, certain clinical conditions such as carcinoma in an immunocompromised patient. So this type of study can be considered as a clinical study, which are divided based on the aim. Based on the randomization, as already told, that is randomized study and non-randomized study. Based on the blinding, single blind, double blind study. Based on the site, there may be field study, laboratory study, or the clinical study. And based on the design, that is the crossover and the parallel study. So the interventions, in such type of intervention, there may be intervention, may be new drug or vaccine. There may be new regime or treatment module. There may be new medical health policies, or any new diagnostic techniques. There may be any new operational or delivery system of healthcare, and there may be new methods of primary prevention, or new programs for screening of early detections of diseases. So there is the multiple type of interventions can be done in such type of studies. What are the strength of studies? Actually, such type of study are considered as a gold standard. So, and it has a very great utmost clinical importance. Generally, these are the most effective research designed to translate the result of basic scientific research into the better ways to either prevent the disease, to diagnose the disease, or to cure the disease, or even to enhance the quality of life of the patient. It is a most convincing, flexible, and appropriate design. It is widely accepted at the global level also. It is a very efficient research design to prove the cause and effect relationship. It is possible to control over the known and unknown confounder. So because we have to remain strict for adopting the appropriate inclusion and exclusion criteria. It has a very huge translational value, so it is very useful for the community health. And it is generally bias free, and it is maximum the reliability of data, it is a very maximum. But on the other hand, there are certain limitations also. It is quite expensive because it requires a lot of infrastructure also, manpower also, trained personnel also, and along with that, it is certain ethical issues are there. So we have to take clearance from the various ethical committee or registered ethical committees, and it requires more resources, more funds, and it is time consuming also. So now we are concluding our session. That is the basic difference between this study design. For example, in a cross-sectional study, there is no intervention, but we can do the study, the risk factor and outcome at the same time. Sampling is necessary. The second type of study, that is case control study, there is again no intervention, but outcome there is first, and then we go retrospectively to find out its risk factor. So matching between history of exposure, that is case and control, is very essential there. In the cohort study, there is again no intervention, but risk factor first, and then we study the outcome. So it is done in prospective in nature. Sampling is essential. RCT, that is randomized control clinical trial, intervention is necessary, and generally first intervention, then we will study the efficacy of, or we will study the effect of that intervention in a particular clinical setting. And sampling, randomization is essential in such type of study. Now generally how we can select the appropriate research design, that is if what is the nature of our question. If we have to find out the burden of specific illness or specific clinical condition in the society, then the cross-sectional study, it is the best type of study design to plan. If we have to measure the prevalence of a particular disease, then cross-sectional study is it may be helpful to the maximum extent. If we have to find out the incidence of the particular clinical conditions, then cohort study, it is the best model. If we have to do causation, or that is association between risk factor, cause and effect, or we have to measure the prognosis of the disease, then case control study, cohort study, and RCT study. These are the three options for us. And if we have to study the treatment efficacy, or we have to effect of the diagnostic tool, or we have to evaluate the cost effectiveness of our regime, then RCT is the best study design for that. So while concluding this session, I think we have to keep in mind about some factors, or following factors should be taken into considerations before planning of any study design. First of all, we have to find out our area of interest, because researcher should be devoted for his or her research. So his area of interest should be chosen first. Then need of the research topic for an individual or society, it is the another demand for selection of study design. Second one, type of research which we have to conduct. Either if we have to do observational study or we have to do interventional study, we have to select first, then we can go ahead. Second one, study of literature review in detail by the researcher is very, very essential, because if we have already, we have select some topic for the study design, but in past there are certain clinical evidences, or there are certain literature which shows that work is already over, then there will be the repetition. So there is no any use of that. So literature review, thorough literature review is very essential. After that type of hypothesis, your research question is very essential. That is what I have to find out. What is happening? How is happening? That is based on the nature of research question, your study design differ. On the other hand, well set aim and objective. Our aim and objective of the research should be clearly defined, because until and unless we can't choose the appropriate study design. Along with that, our outcome, that is primary outcome and the secondary outcome, should be clearly defined to follow or to pursue the proper selection of the study design. Second one, the researcher should be aware about the possible confounding factor that which affect the outcomes of the study. So its knowledge are very essential. Then availability of resources, it is the very important factor while selecting any kind of research design. As I already said earlier, that is the cross-sectional study doesn't require any large resources or large funding. But if we are planning the RCT, then your infrastructure should be competent, and there should be proper fund also. So availability of resources, money, in terms of money, infrastructure, manpower, it is very essential while selecting any research design. Most important thing, time feasibility. As I said earlier, cross-sectional study can be carried out within a stipulated period, that is 2 to 3 weeks to 4 months or 6 months. But if we are doing prospective cohort study, then it is very time consuming. So time feasibility should be considered in mind. As you are the PG scholar, there is some time feasibility, because within 2 hours you have to complete your project. So certain the time limitation should be considered while adopting this study design. Then availability of the object or study population is very essential. If you are taking, if the area of interest of the researcher is some disease like psoriasis, but in your hospital setting, the patient visiting your hospital, that is the patient having psoriasis who visit your hospital, is very negligible, then you can't take this topic, because there will be no abundant, because abundant resource material should be there while planning any study design. Then most important thing, while performing the research, while selecting the research topic, you have to be honest, devoted, and enthusiastic. It is very essential. Otherwise, it will be only formality. Another thing, that is the consideration of strength and weakness of each design, which are already elaborated in the previous slide, is very essential. Because by considering these shortcomings and the lacunae and advantages of research design, we have to adopt the proper research design. So this factor, I think, should be taken into consideration. So my message to audience, or the take home message, that is the act of conducting research should not be a formality. Because if through this research we are generating some clinical evidence, so it should be done in a honest way, in an authentic way, in a rational way. Because if we do just such kind of research in a just like a formality, yes, we have to take just, that is PG studies mandatory, so we can take any topic and we are just performing it in a very casual approach, then it is not a fruitful, because such type of research they may misguide the future researcher also. And so these are maybe hazardous for generating or establishing some sound inferences in the society. So these are my some views regarding the study design. If any have questions, they can ask. Dr. Anshita?
Anshika,
Yes,
please.
ma'am.
Yes, there is some questions in chat box. You can share.
Okay, ma'am. So any questions anyone would like to ask, please be audible and you can really ask them. The delegates can ask their questions from their side. So no questions, I suppose.
Okay, can we conclude here?
Okay.
Yes, ma'am.
Okay, thank you very much, ma'am, for giving us such valuable guidance. Your today's lecture is fabulous and definitely gonna benefit each and every one of us. I would again like to thank Dr. Krishna, sir, ATA Student Wing President, for organizing such kind of lecture series for students' benevolence. Thank you so much, sir, for joining today's lecture series, and thank you for everyone. Thank you.
Thank you very much for the organizer for giving me such a wonderful opportunity to share my views regarding this topic. I think it may be helpful for all our PG scholar to motivate them to do the research in an authentic manner. Thank you very much.
Thank you, ma'am.
Thank you, ma'am.